Welcome back to New Day Northwest. If the pandemic has slowed down your regular visits to the doctor or other medical appointments, you're not alone, but that means there's no time better than right now to get back in a good healthcare routine. Here to help us with that is Dr. Christy Chan from Overlake Medical Center. Thank you for joining us.
Thank you for having me.
You know, I have a friend who always says, Amity, you need to go get your baselines done every year because that's a way of marking where you are, right?
Yes, we would like to see you come in annually for a preventative visit. This is during these visits that we catch up on any screenings that one may need, including even vaccinations. Talking about your family history, one's own risk is very important.
So primary care doctors, I mean, they're kind of the ground zero for everything. What part do they play in cancer screening?
Well, we want to catch things early because if the cancer is caught earlier, it's more treatable and then just having a better quality of life.
When you say it's caught early, it's more treatable. Why is that so important with certain kinds of cancers?
Well, there are certain types of cancer, such as cervical cancer, where we have a very low mortality rate now as well. So that's one example where it's important to come in for those screenings.
I think it's important when it comes to those screenings. I think I shared with you that I had gone a few years back. I'd lost both my parents to cancer, and I went to my primary care provider, and I said, hey, I'm nervous about this. What do? I had this real fear. And his suggestion was to go get genetic cancer testing. Now, that's one of many things you can do, right, when it comes to lowering your risk for cancer, right?
Correct. And so we can provide guidance looking, like your example is family history, and perhaps also just giving you guidance on peace of mind, understanding what is your risks.
How do you lower the risk overall? You know, knowing your family history is one, but the regular doctor's visits are important too, right?
Yeah, correct. So those regular doctor visits allow us to catch up on screenings, like if one needs a mammogram, colon cancer screening, we want to catch it early. And also we just talk about any personal risks, other chronic conditions that we want to consider into this screenings.
One thing I've heard from a lot of people, and I even experienced this with my own family, like my mom, they think, oh, I've been having heartburn lately, it's not that big a deal. How important is it to share these new symptoms that seem to be chronic with your doctor?
Yes, that's also very important. So not only do we want to see you for preventative reasons, but we also do want to see you if any new symptoms develop, such as the one you're talking about, any bleeding, coughing, or blood in the stool, are good examples.
It's kind of scary though, right, when that happens?
Correct, but that's actually what our job is as primary care providers, is to help you guide you through this, the symptoms, and help you, hopefully give you peace of mind and walk you through the process if needed.
And if it's scary, if like something's happening right now in your life and it's scary, you're gonna feel better once you go to the doctor and knowing how to take care of things. What if in the past you've delayed screenings? How do you get back on track?
Well, we welcome you to come in any time. It's never too late. We're always looking for enjoying that new relationship with new patients.
How do you start that conversation with your doctor? I mean, how do you say, hey, I want to have a screening plan?
Well, always be open and honest with us. We always appreciate that, to come to us with your worries, to fight for yourself and talk about what worries you.
Yeah. When it comes to learning more about this, how can people learn more, specifically at Overlake? Say someone's looking for a primary care doctor. I myself am looking for a primary care doctor right now, and it's hard to know where to go, right? I'm like, where do I go?
Well, we have an Overlake website that you can look at. We actually have all our providers listed there, from all our primary care providers to the specialists.
I really appreciate your time. Thank you so much, Dr. Chan, for coming today to talk about this, for all the work you do to keep people alive and healthy.
Okay, thank you for having me.
Absolutely. All right, well, to learn more about what we discussed today or to get in contact with Overlake Medical Center, just visit the website on your screen. Well, our Hot Topics panel with Brooke and Jose from Moving 92.5 have stuck around the whole show to dish out some more hot takes when we come back.
This portion of New Day Northwest is sponsored by Overlake Medical Center.